I decided to record this video. I also wrote a blog as a prelude to an interview that I posted with Representative Catherine McMorris Rogers. I felt it was important to get my opinions across as a backdrop to what the interview says. And the reason this is important to me is because a couple years ago, she was someone I trusted to do the right thing by those of us trying to advocate for people with disabilities. She was someone who we thought of as a true representative, not just a figurehead who had power, who was power hungry and let partisanship rule the agenda beyond doing what was right. Now, after watching this, I honestly am confused and truthfully feeling somewhat betrayed. So I don't want to taint your opinion too much, but I felt it important that I present something. As most of you know, I'm an orthopedic surgeon and a parent of a nearly 21-year-old daughter with Down syndrome. I've written 4 books, and I run an advocacy site dedicated to people with intellectual and physical disabilities. I've written 4. I do feel like I have some understanding of these issues, and although I'm not qualified for everything, I do feel like I'm qualified to at least discuss these issues. My amazing daughter just finished her college program, and she's now working as a summer intern for our U.S. Senator Maria Cantwell here in Seattle. So in her video, she mentions the importance of employment in her interview, and I couldn't agree more with what she says about the importance of employment. She discusses the statistics with regard to people with intellectual disabilities and how often they're employed, and the benefits of employment to both people who have intellectual disabilities in the workforce as well as the people who work with them, and we don't really talk about that enough. There's clear evidence to show that people with intellectual disabilities improve the productivity of the company, improves the environment in the company, and there's many things that we can talk about. And so I couldn't agree with her more on that. Her son, whose name is Cole, has Down syndrome and needs extra health care. And having health care that best fits your needs is crucial, and it's her goal to make sure everyone has access to that. And she discusses that in her video as well, in her interview, I should say. She says time and time again during her interview that Medicaid is crucial to those with disabilities, and that she vows that it won't be cut. She also says that media has it wrong that there will be more funding for Medicaid under the health care bill that she has supported. Last, she discussed the importance of education and inclusion for everyone, but particularly with intellectual disabilities, that our progress towards inclusion in schools makes all the difference when looking at outcomes and independence for those with intellectual disabilities. Now, those are all things we completely agree with: employment, healthcare for all, inclusion, education. Now for this tough stuff. It's all tied together. Employment support and transition programs, college employment for those with intellectual disabilities are tied to Medicaid, and the bill she supports result in less money for those services. It just will. She states in her video that it doesn't cut Medicaid, but the Medicaid expansion included more people, and this bill is going away. She states that the money will increase over the next 10 years, and although I don't believe that's true based on numbers, what happens in 10 years? Are there other bills that he has in the work that are going to come to replace those things? Because everything is funded under those auspices, which leads to her saying that she doesn't want to cut Medicaid, even though she supports a bill and voted for a bill that essentially does just that. She states that the media is wrong, that her bill doesn't do that, but it does. But it's not just the media. It's the CBO, the Kaiser Health Foundation, and every other major medical hospital insurance group has come out against this bill and saying the same exact thing, so it's not just the media. Healthcare is critical. There are already 28 million Americans without healthcare, and the CBO, as well as the Kaiser Health Foundation, predicts this plan will increase those numbers several million-fold. If that weren't enough, it will end many of the portions regarding pre-existing conditions, and Down syndrome has a pre-existing condition. Many of the GOP have said that lack of insurance doesn't kill people, and I know that sounds dramatic, but that's actually not true. There's a study in the Annals of Internal Medicine reviewing all of the current evidence supporting the increased mortality and worsening health of those without insurance. There are many co-founders that confuse the statistics regarding, how mortality and health affects people with insurance. But the fact is that there is an increased risk of dying if you don't have insurance, and this plan increases the numbers of people who aren't insured. I mean, those are the statistics, and you can say what you want about who should pay for it. You can talk about your political agenda and what your beliefs are about who should pay for what, and whether it's a right or how you view health care. But the facts are, if you don't have health care, you have an increased mortality, period. Education, she cites the importance of education, yet early intervention programs are, for people with intellectual disabilities, are based on, you guessed it, Medicaid. To take this even more inspiring is the fact that the current Secretary of Education, whom she supports, is propagating an agenda which has been shown time and time again to be discriminatory against those with disabilities. Whatever you think about charter schools and vouchers, it has never been shown to be positive for people with disabilities. Now, having said that, I must confess that there's currently a movement, and particularly with our Catholic schools, to improve inclusion and help those right those wrongs. But that's not what this administration is proposing. So I can't say that all private schools are bad, all charter schools are bad. That's not what I'm saying. I'm saying, as a rule, the plan for this Secretary of Education has never been shown to benefit anybody with regard to that. And so for her to discuss in her video the importance of education with losing Medicaid dollars and supporting a Secretary of Education who actually proposes things that really are contrary to what our mission is, I think is hypocritical, frankly. The argument for Catherine McMorris Rogers that the media is wrong and the liberals are making this up, except that she's the only Republican in the state of Washington who supported this bill. There are two other Republican representatives who came out against this bill saying exactly what I'm saying. This isn't just me. This isn't just the liberals. There are other conservatives, both in the medical community, the insurance community, the hospital community, and her own Congress, who say the exact same things I'm saying. And oh, by the way, those other two representatives in our state who are GOP representatives don't have somebody, certainly don't have a son with Down syndrome. This bill was passed before the CBO could review it, which is a nonpartisan organization that was created exactly for this purpose. So they scooted this bill through before the CBO even having a chance to look at it. As I said before, every major medical society, hospital group, and insurance companies come out against this. If part of this bill is to support the doctors and hospitals, then why would you not listen to them? Last, as a surgeon who's practiced for nearly 20 years in different states, I was in the Air Force, I was in private practice, and I'm now working with Kaiser. I have a unique perspective. I've worked in private practice, I work with TRICARE, I work with healthcare, I work with Medicare, I've seen all these insurance companies. Every single day of my career, I've had to make decisions based on what insurance was going to or not going to pay for. Whether it was the military, whether it's TRICARE, whether it's Blue Cross, whether it was a co-op or Kaiser. That was true before Obamacare, that was true during Obamacare, and likely whatever comes next. Her comments seem to reveal a lack of understanding of the physician-patient relationship and how that is truly affected by what she proposed. And if so, then as a representative, shouldn't she listen to what we, the people who actually know the subject, have to say? I am doing this video because I really don't understand. It feels unbelievably hypocritical for me, especially for somebody who I respected so much, who I truly felt represented the community people that I try to represent. And I'm doing this video because I really want the community to explain this to me. I want somebody who knows more than I do to say, this is what the deal is, because everything I see is completely contrary to what she says in her video. And if I were to put hypocrisy in the dictionary, this is the definition of it, and I would really like some clarification. Thank you.